Hello, everyone. Welcome. Got another fantastic session today with 6 leading experts. Today in this hour's topic is perspectives on the future of nutrition incentives. With federal funding for nutrition incentive growing substantially from 2008 to 2018, from 20 million to 100 million, and most recently to 250 million. As the field grows and the health and economic benefits become more clear, how might we ensure continued growth and success? What are the roles of federal, state, and philanthropic funding in sustaining and growing the field? And what are the key considerations? Where do we go from here? I'm grateful to be joined by the authors and collaborators of 3 recently published articles and 3 national experts. But before I introduce them, I'll just note that this session is not meant to represent the views of the NTAE or the Nutrition Incentive Hub, but rather offer a platform for the diversity of perspectives that make up our community. And I'll also be the first to note that this panel only begins to scratch the surface of the diversity of this community, and we are eager to hear your thoughts, reactions, and questions, so please type away in the chat box and let us know what's on your mind. On to the introductions. We'll begin with Jennifer Pomeranz, Assistant Professor of the NYU School of Public Health. She'll be discussing her recently published article on a national retail-based food and vegetable subsidy program in the United States. This model is slightly different than a GUSNIP style nutrition incentive program, but highly relevant to the conversation and important for us as a community to discuss. We'll then move to more familiar territory with Sarah John, Evaluation Director of Double Up Food Bucks Boston and New England Nutrition Incentives Collaborative. Sarah recently authored an article in the New England Journal of Public Health titled The Case for a National SNAP Fruit and Vegetable Incentive Program. And our final author / collaborator will be Eli Zegas, Food and Agriculture Policy Director at SPUR, who collaborated on a recently published report titled The Economic Contributions of Healthy Food Incentives. Eli will discuss the impact of bringing in incentives to scale and what it could look like in his home state of California. And from there, we'll move to our panel of experts who will share their reactions and perspectives. This panel includes Mark Nicholson, Policy Director at Fair Food Network, Ben Feldman, Executive Director at Farmers Market Coalition, and Chris Jones, Senior Vice President of Government Relations and Counsel at National Grocer Association. Without further ado, Jennifer Pomeranz from NYU.
Thank you so much. I just have brief slides so you can look at something other than just me speaking. This is the paper that my colleagues and I published in Milbank Quarterly on our fruit and vegetable incentive program. And so I will be speaking on a different topic than GUSNIP, because how we were thinking about this is actually the future, which is kind of perfect for this session. So we, of course, support all the expansions and discussions of SNAP and GUSNIP and all the fruit and vegetable incentive programs that are on their table. But we were thinking one step further about the entire population of the US. So all of the US populations and subpopulations have suboptimal intake of fruits and vegetables. And this is associated with increased risk of obesity and diabetes, cardiovascular disease, and certain types of cancers. Only 12% of US adults meet the CDC fruit recommendations, and only 9% of US adults meet the recommendations for vegetables. So we were thinking about how the fact that high cost and lack of availability were persistent barriers for fruit and vegetable consumption among all Americans. And of course, it's particularly salient among low-income Americans. So the way we were thinking about this is that there would be a national retail-based fruit and vegetable incentive program. And so why retail-based? Because most people do their food shopping in retail establishments. The idea would, and it could also work in farmers markets, it wouldn't exclude them. It was just thinking through that it would at least want to be in the retail environment. But the idea was to broadly support retailers, food retailers, and US farmers by providing a direct pathway to bring fruits and vegetables to the population at the point of sale. So this is great, but then the key question is, how does this actually happen? And that's where this paper comes in. So our government is a federalist system, which means it's made up of a federal government, state governments, and local governments. They all have diverse authorities and sometimes barriers to being able to act. And then we're also talking about non-government organizations, marketplaces, retailers. So we're talking about public and private entities involved in this type of space. So we were analyzing the legal and administrative mechanisms of having a federal national program and what this would look like. So first we looked at existing programs and reviewed hundreds of federal, state, local policies and programs, and then also NGO policies and programs that are supporting fruit and vegetable incentives in different communities and regions around the country. Most of them did target the SNAP population, but there were also WIC and seniors, people that were formerly incarcerated, and other community members. They functioned, as you know, through tokens and coupons. This would be very difficult to scale up on a national level, but we were trying to think through some of the lessons learned. They had different definitions of fruits and vegetables. And then often you had to make a qualifying purchase to actually get the fruits and vegetables. So, and all of the programs were voluntary for vendors. So we thought through these programs and thought about how to scale it up on a national level. So Congress, so if a federal program was going to be enacted, it would be through Congress. Congress has many powers. The relevant powers in this domain would be the powers to tax, spend, or regulate interstate commerce. You don't have to get hung up on the word interstate because that applies to even seemingly local activities. But it's important to understand that Congress cannot require state or local governments to act to carry out a national program. So there has to be a legally feasible mechanism for Congress to actually do this. Congress can also not regulate entities that abstain from commercial activity or require entities to actually engage in commercial activity that are not already doing so. So those are some of the limitations. So we thought through how we would how the different mechanisms Congress could use. And although there are mechanisms for Congress to actually create a mandatory program, which means it would be mandatory for retailers to engage in this program, political and administrative considerations really counsel against some type of mandatory program. If people want to ask questions about how that would or is feasible, I'd be happy to answer them. But different mechanisms through the Commerce Clause or even taxation, using direct licensing and different strategies to kind of require these programs. But again, this is not highly feasible politically, and it's also would not be great for retailers that are fragile or working in low-income communities, potentially could close if they couldn't comply and all that. So the bottom line is that all considerations and the current program support a voluntary program that would be administered through a conditional funding mechanism. So conditional funding means that the federal government provides funds to either other governments or NGOs or entities to basically engage in a program within the parameters that the federal government sets forth. So this is very common. It's a very common way the federal government uses to basically implement federal objectives on a national scale. So there are two different types of funding mechanisms that Congress might use: a direct spending program. Examples of this are SNAP and Medicare and the farm commodities programs. These are direct spending programs. As you know, they're reauthorized through SNAP. SNAP and the farm commodities are reauthorized through the Farm Bill. But these are mechanisms to provide appropriations that don't have to go through an annual appropriations decision, and it's governed by statutory criteria. A second mechanism is called a categorical grant. These are restricted to a specific purpose, and they do go through annual appropriations processes, but we do have many programs that work this way, like WIC and Medicaid. And so federal funding is allocated based on a formula set out for the states. So our conclusion was that this type of a voluntary program where funding was provided now to either state, local governments, or actually private or non-governmental organizations like NGOs to carry out the program. And then once you actually get to those questions, then there's additional legal and feasibility questions on this. So if they were going to be providing funding, for example, to the states, Then states have options of how they are going to work with the retailers. They could either also provide funding or engage similarly as SNAP does now, or they could create a mandatory program where they license retailers and require retailers to provide fruit and vegetable incentives. But our idea envisions that this is something that goes through and to the retailers, including farmers markets, but meaning that we're trying to seek the least amount of work for a consumer that to need to act. We don't want to have consumers have to obtain and retain a card, but rather have this kind of immediate reduction happen at the point of sale to increase participation and make this a little effort for people to have be incentivized to have and purchase and use and eat fruits and vegetables. And so the overall program would, of course, want to engage with the key stakeholders, all of whom are basically at this conference today, and learn lessons learned on how to best scale this up and ensure flexibility at the state and local level for the program to be effectuated. So yes, this is very different from everything you guys have been talking about, but we think that this is some type of an idea for the future to try to help incentivize fruit and vegetable consumption on the national population. And I look forward to your questions, and feel free to email me if you have any questions that we don't get to today. Thank you.
Thanks, Jennifer. And thanks so much for the opportunity to discuss our recent AJPH commentary on the case for a national SNAP incentive program. I also want to acknowledge my co-authors, including Reese Lyerly, Park Wilde, and Amy Nunn. I'll start with a brief overview of why now is the time to pursue a national cohesive incentive program, and then discuss what that scaled program could look like to maximize impact. So why now? We believe there's adequate evidence on desired incentive program outcomes, including fruit and vegetable consumption, yet inadequate funding to sustain current program growth. Evidence exists that SNAP fruit and vegetable incentives improve healthy eating behaviors. There are other sessions dedicated at this conference solely to this topic, including the great session yesterday on making the case. So I'm not going to spend a ton of time here, but there's robust evidence of positive program impacts. Most notably with the high internal validity of the Healthy Incentives Pilot, which I'm sure you're all well aware of, a large randomized control trial that found SNAP incentives close 20% of the current gap between current fruit and vegetable consumption and dietary guidelines for Americans' recommendations. There's also compelling systematic reviews that cover robust individual program evaluations, including those from Finney and GusNIP grants. However, despite sufficient evidence, there is insufficient sustainable funding. As SNAP incentives continue to grow, the current small grants model is no longer sustainable as consumer demand outpaces program budgets. Just one example in New England is with Massachusetts HIP, an often cited success story in terms of garnering state funding. However, in 2018, the program spent its entire $1.3 million three-year budget in less than a year, followed by subsequent suspensions in 2019 and 2020. The goal of these programs is to reach more people. However, the current funding structure means program growth jeopardizes these programs, enforcing contractions in scope, limiting continuity in program participation, and ultimately desired program outcomes like healthy eating behaviors. Additionally, GusNIP dollar-for-dollar non-federal financial match requirements can be burdensome and unrealistic for some program operators, especially as programs scale and as budgets increase exponentially. So with that in mind, what could a national SNAP incentive program look like? As you know, while people often collectively refer to SNAP incentives, there is considerable variation in program design, in part intentional for Finney and now GusNIP to implement and evaluate various models across the country. We can leverage this variation in current incentive program designs to propose a potential nationwide incentive program that maximizes impact. We thought of this across three categories: match, mechanism, and targets. In terms of match, this includes match rate, or the incentive provided relative to customer SNAP expenditure, as well as match cap, the incentive maximum. We recommend 100% or dollar for dollar match rate with no match cap. There's considerable variation in match rate, from 30% in HIP, 40% early farmers market programs, as well as 100% in the majority of the Finney funded projects that were featured in the interim report. We believe that 100% match rate maximizes the impact in offering the lowest effective price for fruits and vegetables. It's also easy to communicate to potential participants and stakeholders. Saying spend $1, earn $1, or get half off is a lot clearer than spend $5, get back $2, and trying to figure out that that's a 29% discount. We also recommend no match cap. Again, variation in programs across match cap, including a household-based maximum in HIP, transaction-based maximum in many programs, and then no match cap in other programs, such as the majority of our partners in the New England Nutrition Incentive Collaborative. So yeah, as funding permits, we think having no match cap maximizes impact and avoids unnecessary complexities. When it comes to the incentive mechanism, we also think of this in two categories. One being the delivery mechanism, one option being electronic through either a point of sale system or EBT card, or a physical system like with tokens or coupons. And then also can consider the economic mechanism, whether the program uses an instant rebate or voucher for fruits and vegetables. We recommend an instant electronic incentive mechanism. We believe this model optimizes redemption rates. As seen in the Finney interim report, the majority of Finney retailers adopted a rebate model. And while these retailers distributed $17.3 million in incentives, they redeemed only $14.2 million in incentives, so losing about 18%. We also think that this is a streamlined model with greater inherent capacity for monitoring and evaluation, something that becomes even more important as we think about scaling and assessing these programs. And last but not least, also, we believe an electronic incentive mechanism reduces stigma. So not forcing incentive program participants to have to use special tokens or coupons, kind of much for the same rationale that an EBT card was introduced in the first place in SNAP. Finally, we consider program targets, including target population, target foods, and target retailers. We recommend integration with SNAP, so it's accessible to all SNAP participants across the country. As Jennifer noted, of course, there are broader population-wide needs for increased fruit and vegetable consumption, but SNAP participants do consume less fruits and vegetables and are at a greater risk for diet-related disease. And from a pragmatic standpoint, SNAP provides an infrastructure that's a critical backbone to take incentive programs to scale. We also recommend fruits and vegetables in all forms, fresh, canned, frozen, local, and non-local fruits and vegetables to maximize consumption year-round. There's also some evidence of smaller effect size in programs that place restrictions on fruit and vegetable form. And finally, we recommend implementation at all SNAP authorized retailers. So, but also making sure that these programs work in the large retail setting where nearly 90% of SNAP benefits are spent. We are not saying that we have the absolute perfect program design that will work everywhere. And future research on these program elements is warranted. But we do believe that to continue to grow and scale these programs, we should have confidence in incentives' positive impact on healthy eating behaviors. We should understand that the current funding model cannot sustain the trajectory of successful program growth. And we should know that we can leverage the existing evidence to create a national SNAP incentive program that can stimulate economic activity through increased purchasing power, can improve the health of millions of Americans, and can generate more than $1 billion in healthcare savings. Thank you.
Sarah, I feel glad that I am following up on your presentation because there is a lot of overlap between what you just said and what I'll be saying with slightly different perspective. And I come at this with two perspectives. One is as someone who works on the ground, running a Double Up Food Bucks program in and around San Jose, California at 7 grocery stores, but also as an advocate. SPUR as an organization has a goal to make healthy food incentives a long-term permanent supplement to our state SNAP program. So we are actively working in the state to try and scale this statewide. And so in that process, think a lot about the things you've raised, and I want to highlight some of them here as well. So I'm going to pull up my screen. I want to thank Noam for inviting me to be on this panel. I'm super excited for this conversation, and we'll start us off here. So first, though, I'm going to talk about a report, the one that Noam mentioned that we, SPUR and Fair Food Network, came together to do, which was like, what would scale look like? And so I'm going to quickly highlight those and then transition to talk about some thoughts on the future of incentives. So we collaborated with a number of groups to look at this. What would scale look like, especially in terms of economics? We partnered with a team of agricultural economists at Colorado State University, listed here. And we also partnered with many organizations across the country, 10 listed here, who provided data. Well, they provided advice to help guide us as we thought about scaling and the assumptions we were making in the modeling. But they also provided data so that it was grounded in some actual on-the-ground numbers. What did we come up with? These are what SPUR and Fair Food Network both like to think of as very conservative to conservative estimates of the amount of money flowing into people's pockets, specifically SNAP families' pockets. And you can think of this as the benefit to families in terms of incentives redeemed each year, or the cost of incentives per year, not the cost of the whole program, but the cost of incentives. The bottom row, if you want to think about this nationally, it's 683 million to 1.4 billion per year is what was estimated. And again, I could talk more about why we think those are conservative estimates, but I think that's a solid ballpark that we would hit that. The reason it's a range depends on how many people are enrolled in SNAP any given year. So we picked a low bound and a high bound there. It's based on the assumptions we made of how many retailers would offer this. To Jennifer's point, it's a voluntary program. How many would opt in to want to do it? And the range also, or the variability, the conservative aspect of it, comes from a ratio that we based off the data we got from people of basically for $100 of SNAP, how much would you expect to see in terms of incentive redeemed at any given retail outlet? Happy to talk about how we came to those numbers, but I'd like to transition to looking ahead. How do we get to this scale? How do we get to the point where either a whole state, like the ones you see listed here, or the country could have a program like this? And Sarah and I think are tracking in a lot of ways, but I'm going to frame it up slightly differently. So it's one perspective. Like Sarah, I don't pretend to have the answer that works for everyone, but one thing I do want to emphasize is I think there is space to consider a framework that the federal government could support, within which states could do quite a bit of variability. And so that there's not a one size fits all, but there may be, and I think there is, a way to set some frames that allow a lot of programs to scale a lot bigger, or things that will set them up to scale bigger with federal support and or state support. So who, like Sarah said, SNAP recipients, the infrastructure's there, the programs already do that, let's keep doing that. Where? Similar to what Sarah said, any retail outlet that accepts SNAP and sells eligible products, let's make this as ubiquitous as possible. What? And this is the program design, and I want to spend a second here. I think it's really important that we support any program design that's shown to increase fruit and vegetable consumption. And you see here highlighted in green a program design that previously was supported by FINI and by the GusNIP funding until the most recent RFA, which is an earn on produce, redeem on SNAP. This is the model that was piloted in the Massachusetts HIP example. It's how Massachusetts HIP currently works, and it's also how California's fruit and vegetable EBT pilot is set up. And I think it's been shown through the randomized control trial study that Sarah mentioned that it does improve fruit and vegetable consumption. And we now have 2 states that have invested a tremendous amount of money and energy to scale their programs very large, and the potential to go even larger with more money. And I'm very concerned that if those states and USDA go down different paths that are diverging, it will cause problems for the future of incentives. And so I would really love for us to see all 3 of these models continue to be included going forward as they were previously. I'm happy to talk about that more, but from a California perspective, it's definitely something that's come up of concern recently. Also agree with Sarah, at least a 1-to-1 match. I think there's potential to consider higher. I think it's not worth going lower, both for the communication reasons Sarah mentioned, and also if it's a concern of money, funding, there are other ways to throttle the program and its costs, like caps, that don't cause the communications issues. And it's just a lot easier to keep it at 1-to-1 or higher. How? Also agree here, scale is really only possible, or it's only possible to be efficient when it's done with mechanisms that are efficient themselves. And so the EBT card and the EBT system can allow for that, or a loyalty card. There are some that are transferable across retailers, and if someone could come up with a model that would work at a statewide level, it has the same benefits, where you move away from paper invoices and paper coupons and collecting those. I will note, have heard loud and clear in California and elsewhere, that that's a different situation at farmers markets. And while in Massachusetts they're doing it, where each vendor is swiping cards, it's going to take some time to get there for most farmers markets across the country. Who pays? The state and or federal government, with stable funding, not grant funding. I think this is one of the biggest things, is we will not be able to truly reach the scale we want until the program has stable, permanent funding. So that could either come through the Farm Bill, it could come from state revenue, it could come from some mix. But we're not going to be able to really count on these programs expanding and without stable, larger funding. Here is a list of variables. So I think highlighting, there are lots of things that states could choose to do differently. The caps, whether you want to higher match at farmers markets, recognizing the economic benefit of local food economies. Local component is different in California than it is in other places. Like Sarah said, which fruits and vegetables are allowed. WIC incentives, once they become available on EBT, once WIC is on EBT, as it is, I believe, in some states, you can do that more easily. What funding on top of the incentives is dedicated to help promote this, administer it, provide technical assistance, how it's audited and who it's audited by. I think that depends on who funds it. Depends on the budget, depends on the geography. Where I want to end is that, just like Sarah said, we know these programs work. After 10 years of running incentives, we have the evidence they reduce hunger, improve nutrition, and provide economic stimulus. We also know, as we heard from Debbie Stabenow at the start, there is a huge need for these programs right now, which means it's really important for us to think hard about how to move from pilot to permanent sooner rather than later. We really need to do this as a field. We need the stable and consistent funding. I've offered an outline of some ways I think that could help us move in that direction, in which multiple models can thrive. I know other people have lots of great ideas and experience, and I look forward to us discussing them. But I have a deep passion, and I think we are at a point in which we can think about scaling these programs across states and nationally. And we need to think about the perfect not being the enemy of the good. And if we know something works and it can scale, let's do it. And with that, look forward to the discussion.
Thank you very much, Jennifer, Sarah, and Eli, for sharing this fantastic research and insights. I'm Mark Nicholson. I'm the Policy Director at Fair Food Network, and I'm just going to transition us into the next portion of our discussion here. And really the goal in sharing these studies is not, as Eli and the others have pointed out, to necessarily endorse one model over the other, but rather to see the conversation on a question that I'm kind of posing is, what could nutrition incentives look like in 2028? And the reason for this time frame is that to arrive at that vision, we really need to start the conversation now. The legislative work on the next Farm Bill will start in earnest in the end of this year. What we do in this Farm Bill will guide nutrition incentives into 2028 and beyond. So now I'm very happy to welcome Ben Feldman, the Executive Director for the National Farmers Market Coalition, and Chris Jones, the Senior Vice President of Government Relations and Counsel for the National Grocers Association. And Ben and Chris have been asked to share their perspectives on what they've heard today and the future of nutrition incentives. And I will throw my thoughts in there at the end. Ben, the floor is all yours.
Thanks, Mark. Appreciate the opportunity to share the perspective of the Farmers Market Coalition on the future of incentives. I think our panelists here have really keyed up this conversation and made clear the need for expansion of nutrition incentive programs and that overall the demand basically from the very beginning, as we heard from yesterday from Oren and Michelle, the very first of these programs were already outstripping the resources that were provided for them. And we've largely seen that across the board as these programs have expanded, is that demand by communities to participate and SNAP shoppers to participate have gone beyond the source of funding. And so the opportunity to bring additional resources and structure the program in such a way that it isn't dependent on, as has been described, these limited grant opportunities is something that really is becoming quite clear. I do want to emphasize from the Farmers Market Coalition perspective, the need to think about these, to continue to think about these programs holistically. Obviously, these programs began in farmers markets, and the success of the programs to date has a lot to do with the ability to bring together both low-income shoppers who are using SNAP as well as farmers and the farm side impacts. We talked a little bit earlier this morning in our policy roundup about the challenge in creating isolation and silos in programs. And we've seen this, the farmers market community has seen this a lot in recent years as these programs have already begun to scale. We've seen whether intentional or accidental activities or rulings, administrative decisions that have reduced the ability of the farmers market community and other direct marketing outlets to participate in these programs. And the advantage of the history of these programs and the dual nature of these programs is not just about, it's not just about either the farm side or the consumer side. It's that by bringing these programs, these constituents together, we create a more robust program, both from terms of economic impacts, but also potentially in terms of health outcomes. There are definitely health implications that a farmer's market setting or other direct retail settings where farmers are able to directly engage with consumers and vice versa that don't exist in other settings. And so that's a really important consideration. Again, the economic indicators of it are much stronger when there are, whether it's local sourcing requirements or even better operated in short supply chains, local communities benefit from the economics of these federal programs more effectively. The concern, of course, is that if we scale, if we exclusively continue to scale in grocery store, we're replicating a lot of the existing problems with our food system, right? So that is not to say we shouldn't be scaling in grocery stores, but we sometimes we hear the idea of meeting SNAP shoppers where they are, which is an important consideration. But what about thinking about reimagining our food system? And for many folks, nutrition incentives offer us a potential roadmap because of this connection between various aspects of the food system that are so absent in so many of our systems. So when we look towards the future and we scale these programs, really, I want us to be thinking about rethinking how our food system operates and that rethinking the entire SNAP or our food assistance program. We heard from our panelists earlier today that simply even expanding nutrition incentives alone is not enough to address food insecurity or the challenges American farmers are facing either. So ultimately, I think we need to think about the lessons that we've learned from incentive programs, what they've been able to do, and use it as a way of modeling a food system or even a social service system within our country that recognizes that the fundamental challenges that people who are food insecure are facing are in many cases created or the same challenges that our food producers are experiencing. And as we move forward, if we continue to allow nutrition incentive programs to be isolated, we run the risk of exacerbating these problems and really not taking advantage of this wonderful opportunity that these programs have really shown as a path forward for how we might think about a future food system. Chris, I'll hand it off to you.
Sure. Thank you, Ben. Thank you, Mark and Fair Food Network for inviting me to join this panel. Been an interesting discussion thus far. Just to give you a little background on NGA, who we are. So we represent the independent grocers in Washington, D.C. I'm the head lobbyist. All of our members are privately owned grocery stores, and we're anywhere in between a single store operator and a larger regional chain. And we go through this process every 5 years of thinking about how we can, rework nutrition programs to make them work better for mainly SNAP recipients. We see ourselves as the single most important private partner in the public-private partnership of SNAP. And it is proven to be an effective program that has eradicated food insecurity in a lot of communities across the country. Obviously, there's a lot more we need to do, and that's why I appreciate having these kinds of discussions about where programs ought to head. So in terms of where we go on incentives specifically, we kind of came at this in the beginning from kind of a different perspective. One of our perennial fights every time we're on the Hill talking about the Farm Bill, we're worried about the idea of imposing restrictions on SNAP shoppers for many different reasons. One where we worry about the stigma that would create, the burden that would create on grocery stores, the idea that grocers would have to go through and determine which products are in, which products are out, and where you draw that line. And when incentives were imagined in the HIP project and then later in Finney, we noticed our members had a lot of interest in participating in these programs. And so that's been kind of a major goal for us going into the Farm Bill. We want to get more of these programs in grocery stores because there's a lot of evidence that if it's designed correctly, it will work. But I think there's a bit of a misconception within the community about grocery stores and how we operate. So one thing is that incentive programs are not a profit center for grocery stores. They just aren't, and they won't be. The reason our members are so interested in these programs is because they care about the communities in which they operate. Our members are they're in their communities. They care about their customers. They want to offer the most value possible to their customers. So our biggest issue with incentives is the hurdles to overcome in order to operate an effective program and get more retailers who are interested in participating in it to do it, without it being a major burden for them. And so after the last Farm Bill, after the major scaling up of incentives, our NGA's foundation was lucky to get involved with Fair Food Network, Farmers Market Coalition, and Gretchen Swanson Center in this nutrition hub, this incentive hub. And we've learned a lot from this process about where kind of the major pain points are. And so that's why I like the presentation earlier from the three, from Spur and the practitioners out there. And I think we would probably borrow from each of these ideas. So let me just kind of go through the major pain points that we've hit. I'd say number one, by far and away, we have challenges at point of sale, and that varies based on what the incentive looks like. So in a lot of cases, just based on whatever program design a grantee has, our point of sale solutions can't match what's required. And it takes a lot of effort and work with point of sale technology providers to get to where you need to be so an incentive works. The other problem with that is that there's no common set of standards about what incentives should look like at point of sale. And what we've noticed and worried about is opportunities for gaming the system. Integrity is probably one of our number one priorities with SNAP, and that anytime that there is a bad news story out there about SNAP, anytime there's one instance of fraud, we have to go on the Hill and explain to everyone that this program is by and large one of the most effective error-free programs in the federal government. So anytime that there's a knock on SNAP, it gets a bad name for itself, and then we have to kind of clean it up. My worry is that could happen with incentives in cases where, we don't have as much integrity over the delivery system on incentives. So I think, the one major thing that we've learned from this process is that there has to be some kind of standards that govern the way that incentives are delivered, so that those opportunities for gaming, those opportunities for fraud don't exist, so that this can be viable going into the future. It can be viable as a solution for producers. It can be viable as a solution for retailers, as well as the SNAP customers. So that's really key, is making this part of the future. And part of the problem is there isn't really much regulation over it. There isn't a lot of oversight. There is some from USDA, and depending on who the grantees are. But one thing we're thinking about is should these programs be run through the state, the local state SNAP agencies? Should it be a component of SNAP Ed? We're having discussions like that. And then the other thing is, since you have so many different models out there about how incentives work and how incentives are structured, the idea of scaling it so that we can get increased participation is really attractive to us, especially for grocers that have a lot of different locations and want to participate at each of their locations. And then the other piece of it too is, the way to minimize the overhead and challenge for the independent grocer is to not require much intervention at all from the cashier, from the grocer, from the employees. If you could put it on the EBT card, the way that that Eli is looking at, that's truly the ideal. That's where we want to end up eventually. Putting the incentive direct, we already do it with TANF. We do it with a lot of other opportunities at the state level. And so if states are overseeing this program, kind of in the vein of what Jennifer was getting at, then they're going to have an opportunity to design it and add on these additional benefits. And we're already seeing that work happening in California, which is exciting to see. The other piece too is we need to target the right populations. I think that's we've seen a lot of challenges out there in terms of making sure we're hitting the right folks who really need the incentives. There's a lot of areas where diet-related diseases are prevalent, and there are no incentive programs. So we think that states may have the ability to identify which populations need to be served the most and target those places with incentives. So we're very early in the process of deciding, what should be next. We're learning a lot with the foundation's participation in the hub. But ultimately, we think incentives are the future, and we want to make it so that it's viable politically and for all the folks involved in it well into the future.
Excellent. Well, thank you both, Ben and Chris. And I know we are scheduled to end at 2:45, but we're going to carry just a little further so I can wrap up with some comments here. They don't throw us out till 2:50, so I'm going to try and make this pretty quick. And I apologize for the background noise. I'm in my office and I don't have control over what's going on around me. So I just wanted to kind of turn the question back. And I think we've done a great job of framing up some of the considerations that have to take place. This question of what nutrition incentives should or need to look like in 2028, as you can see, is a really big one. Why is that important? Well, as we've touched on, that process is starting now, and a lot of conversations have to kind of go on, as you can see, to try and look at what is the ideal or something that we can work towards. As has been mentioned, we have a real favorable political landscape right now. Senator Stabenow teed that up in her keynote, kicking off this conference yesterday. And it's not just Senator Stabenow. Even the ranking member on the Senate Ag Committee, Senator Bozeman, has been supportive of these in the past. On the House side, we've got a new chairman, Representative David Scott from Georgia, who even today had kicked off a hearing on food insecurity. And so they're very focused on this as a priority in the House side too. And for anybody who's been following Secretary Vilsack over the last several days, he has been extensively using the term nutrition security and drawing out the distinction between the quality of food as a key component to food security. We have a tremendous understanding through this pandemic in the public broadly of what we're trying to work at here on hunger, on the impacts of diet-related disease, and on the food system and the resiliency of that food system. And additionally, we have just gone through a process these last 8 months that successfully resulted in us securing $75 million in emergency funding in the last round of COVID relief for GusNIP programs, indicating that bipartisan support for the program that is already out there. So what do we do next with all this information? What do we do next with trying to bring the conversation together? And I would suggest that, it starts with everyone's own operations, own programs. What do you know that's working in your program? Identify, where are the barriers to expansion? We've seen some of that in this RFA process. We've already seen it drawn out in some of the studies, and we know that the match is certainly one thing that's on people's minds. But envision what the expansion could look like for you and your programs, and what resources would that require? What do we need to go to the Hill and ask for incentives, for administration, for evaluation? And then, start that work now. A lot of folks have been engaged in work within their states to build state funding. And that is the exact same coalition work we need to do on the federal level. Agriculture and the retail sector are going to be critical to the bipartisan appeal. Public health, hunger and feeding organizations are key to these programs as well. And let's not overlook our state agencies that we've been partnering with over this last decade. So this should all help inform where we have overlapping challenges and opportunities. And I guess if there's one point I kind of want us to leave with is to fully realize the potential for GusNIP in the next Farm Bill, we really are going to need to be speaking with a united voice. And so, I don't have necessarily much more to add to what everyone's provided. Fair Food Network hasn't, gotten to a point where internally we have our positions. But I will share that my perspective certainly has been influenced by my last 20 years on the producer side. I was actually selling summer fruits to a local food bank that was putting them on a mobile truck and selling them with the support of nutrition incentives. I had no idea that that was generating those sales to my family business. And then as a leader in the apple industry, serving as a chairman of the U.S. Apple Association, over 15 years of that work, I actually was never really introduced or exposed to nutrition incentives. And this is all the while one of the top priorities for most producer associations is to expand consumption. It's the top target for most public health organizations as well. So expanding fruit and vegetable consumption is something that I think that we can really achieve with a much broader program with much broader impact. And then I'll say, my perspective of launching brands and products, this feels a lot like it's a hot market. And so there's this risk of not expanding and taking advantage of that favorable landscape. We refer to that as failure to launch. But that's also has to be balanced with the risk of growing too quickly and risking the entire business. So I believe that working with intention and transparency, we can greatly improve the effectiveness and impact of GusNIP in the 2023 Farm Bill. And I, for one, am very much looking forward to working with the nutrition incentive community and our coalition partners to achieve these goals. So with that, I know we're up and about out of time. I don't know that we'll have time for any questions, but I certainly have really appreciated the opportunity to get these views out and start this conversation that we need to carry forward. Noam, do you have anything to add?
Thank you, Mark. Thank you, everyone. I think we're about to get kicked out of the session automatically in a few seconds, so right on time. But thanks so much, everyone, and we'll see you at the next one. Thank you.
Thank you.